Hi, my name is Mike Boyes. I'm a developmental psychologist and I retired recently from the University of Calgary after spending 31 years teaching and doing research into various areas of human growth and development. My own research interests have focused on a number of areas including human identity development and human reactions to a variety of life circumstances. What I want to talk to you about now is post-traumatic stress disorder and a project that I'm helping out with centering around a variety of animal-assisted approaches for helping people dealing with that particular disorder. So this is going to include, among other groups, Ron and Arla's medicine horse therapy program in Saskatoon, and a number of other programs that involve the use of different kinds of animals in providing assistance for people struggling with symptoms of PTSD. If you get a chance to come and spend some time talking to me about this, I can give you a much more detailed overview of the relationship between PTSD and a variety of different approaches to treatment and therapy, including some of the more promising data that's starting to come out just now on the efficacy of animal-assisted interventions. For now, I just want to say a very few things about post-traumatic stress disorder and a little bit about how animal-assisted interventions seem to be assisting people struggling with those conditions. Post-traumatic stress disorder, or PTSD, is characterized as one of a number of what we call anxiety disorders, mainly due to the fact that one of its primary presentations are the feelings of anxiousness or anxiety that the individuals experience, sometimes on an ongoing basis. Post-traumatic stress disorder is driven by an area of the brain that we think of as evolutionarily old. And what that means is that it's a very deep down in the brainstem area of the brain that was evolved very early in our evolutionary process and was basically developed because of the adaptations it provided in very basic ways. Essentially what it does is it prepares us to engage in fight or flight. In other words, when we feel threatened, and we have to then do something about it, either fight or contend against the threat or run away from the threat. This is the area of the brain that fires us up so we can do that. It provides us with a big adrenaline push so we can get everything working. It opens up our lungs, it raises our heart rate, it focuses our attention, keeps us from getting distracted by higher level thoughts, and all of that makes it possible for us to perform optimally in those kinds of threatening circumstances. Now, the kinds of threatening circumstances that it evolved to deal with are potentially quite intense, but very short term. So imagine you're out hunting and gathering and you encounter a bear. Well, your encounter with that bear is going to be relatively short. Either you're going to get away or you're not, but either way it's going to be over fairly quickly. And so what we have is a system that gears us up for those short-term kinds of events that we have to deal with and get past, and then go back to hopefully a relatively relaxed state afterwards. The difficulty with PTSD is that it occurs in people who've had traumatic life events. And this could be everything from child abuse to automobile accidents to the death of a loved one to experience in active military theaters. All of those sorts of things can certainly be traumatizing, and especially if they're somewhat unexpected, as most of them typically are, what it can create is not just the immediate PTSD or the immediate stress response that we see driven by the amygdala, but the effects of that response can carry over and create a kind of a hypervigilance where the person is basically carrying the stress and anxiety and is being potentially triggered with reminders of that particular event over and over and over again. It can be quite debilitating. I'm not going to go through the symptoms of PTSD here, but it's enough to say that it has very broad-reaching effects. It affects how you think, it affects how your emotions function, it affects how your emotions can get triggered quite unexpectedly. It can cause you to avoid social interaction, it can cause you to avoid specific situations and events because they might trigger these sorts of feelings and reactions, and it can make it very difficult to function in the world. Essentially, it's as if a part of your bodily system that is there for ostensibly a good purpose is over-functioning. And because it's such a low-level area of the brain, we don't have a lot of conscious control over it. And that's the big part of the problem with PTSD. There are higher centers of the brain up in our frontal lobes that allow us to think and reflect upon our life circumstances, but they work much more slowly. The amygdala area of our brain has evolved to allow us to respond very quickly to threatening situations. So if we think we see a snake in the grass, we're going to jump away long before we think about whether it's a snake, what kind of a snake it is, and all that higher level kind of functioning. We're going to react defensively immediately. And that's the kind of reaction pattern that keeps us alive in those sorts of situations, but also if it overfunctions, basically creates the symptom patterns that we characterize as reflecting post-traumatic stress disorder. One of the important things to know about post-traumatic stress disorder is that it's actually quite common. In terms of lifetime prevalence, the data is suggesting that between 7 and 9% of the entire population will at some point in their lives experience some aspects or some version of the symptom patterns that we characterize as PTSD. That's a lot. If you look at this list of other disorder categories here, you can get a sense of how common PTSD actually is. It's not as high as depression, but it's higher than bipolar disorder. It's in the same ballpark as alcohol dependence and is significantly higher than major disorders like schizophrenia. Bottom line is that PTSD is much more common than we typically think it is, and every single one of us probably knows at least one person, and maybe more than one, who are struggling, have struggled, or will struggle with the symptoms of PTSD at some point in their lives. So it's important for all of us to know more about it. And as importantly, to know about the kinds of things that we can do or to help people do that'll make a difference for them. There are a variety of risk factors that can predispose people to have issues related to PTSD following traumatic life events. And this slide will give you kind of an overview of those. It can include things like having lived through dangerous events, having gotten hurt, seeing another person hurt or seeing a body. All of those, of course, much more likely to occur in military assignments, but can occur anywhere. Childhood traumas, feeling horror or helpless or extreme fear is another area. Having little or no social support after the event, no opportunity to talk about it because it's not considered appropriate or you don't feel able to. Dealing with the extra stress after the event, such as loss of a loved one, pain, injury, loss of a job or home, all of those things can contribute to post-traumatic stress, or having a history of mental illness and substance abuse. So all of those things can increase the possibility that if someone experiences a traumatic event or series of traumatic events, that they're going to show signs and symptoms of PTSD. There are a variety of factors that we call resilience factors, things that can help in people managing more effectively when traumatic events occur. If they're good at seeking out support from other people, friends and family, reaching out to them and using their support. If they're able to find a support group after the traumatic event. If they can learn to feel good about the actions that they undertook in the face of the danger as opposed to blaming themselves for how things went. If they have positive coping strategies, in other words, a way of focusing on and dealing with bad things that occur to them. And if they're able to act and respond effectively despite being fearful, sort of getting going again. Now, what all of those factors have in common, if you think about it, is that the symptoms of PTSD are going to get in the way of every single one of them, potentially. And so one of the biggest challenges in helping people struggling with PTSD is to get them into a place where they feel comfortable reaching out and gaining assistance. And that's one of the things that animal-assisted therapy seems to be quite helpful in doing, helping them to get to a point where they feel comfortable about starting to address the kinds of issues that they're dealing with. They don't feel constantly agitated, constantly hypervigilant, but are able to kind of maintain a bit of a perspective on the situation that they're in and then go out and get the kind of assistance they need, whether that's therapy, whether that's simply making some better social connections. Any of those sorts of things can all be helpful, and what's going to be helpful is going to vary from individual to individual, but what's going to be the same is their need to go out and make some sort of connection. And animal-assisted therapies seem to be helpful in getting people moving in positive directions when they're struggling with PTSD. Now, chances are you've seen something in the media already somewhere about the positive effects of animal assistance for those people struggling with post-traumatic stress disorder symptoms. And certainly there has been a lot in the media about this particular condition and this particular approach to treatment. There's actually a whole array of animal-related engagements for individuals with PTSD. We can talk about animal-assisted therapy that's been done where animals are used as part of regular therapy for people with PTSD, but also with autistic spectrum disordered young people and a whole variety of other disorder categories. You may have seen reference to companion animals, and most likely dogs, particularly for military veterans. There's been a fair bit of work done in providing military veterans who are struggling with PTSD with a companion animal, a dog, and that seems to be, again, very positive in terms of helping them basically manage the hyperarousal and other symptoms related to PTSD, and then basically move forward kind of more adaptively, being able to get back to work and those sorts of things. They're a part of a larger treatment program, but a very important part. You may have also seen reference to a bunch of work done with horses, and certainly the work that Ron and Arla do with medicine horse therapy is the kind of treatment approach or activity approach that seems to be very helpful. Now, when we look, though, for scientific data, there's not a whole lot out there that tells us systematically how well these sorts of approaches work for people struggling with PTSD, or perhaps as importantly, that tells us very much about how they actually work. So we're still trying to figure that out. And a big part of this kind of ongoing project is going to be to try and contribute to both of those sorts of questions. How well does it work, and what sort of factors seem to be important in helping us to understand why it works the way it does. Over the past few years, I've worked with medicine horse therapy and Ron and Arla to gather some data about a number of programs that they put in place for dealing with different aspects of individual development that might be assisted by spending some time with horses. Now, specifically, there was one project that looked at the involvement with horses and positive effects related to that for young Aboriginal youth, particularly problematic point in development for an awful lot of them. And we're able to show fairly clearly some positive impacts related not just to personal well-being, but also to increasingly positive attitudes towards school and education as well. We also gathered some data looking at a horse therapy program that was run for victims of domestic violence. And again, we're able to show lowering of sort of some of the PTSD-related symptoms of stress and anxiety, and also increases in areas of general well-being. So we do have some data on this local program. What we're wanting to do going forward is to make sure that every effort that's made locally to engage individuals struggling with symptoms of post-traumatic stress disorder in some sort of animal-assisted program, whether with horses or using other animals, that we gather some information or some data about how that goes. Now, one of the advantages of PTSD is that there are a number of very well-proven measures out there that allow us to kind of regularly, not just once or twice, but before treatment, during treatment, after treatment, and over time for follow-up, gather some fairly detailed checklist data about symptom patterns amongst the individuals that are struggling with the symptoms of this disorder. And that's going to give us a fairly clear picture of whether this approach is actually working, and will start to allow us to dig in a little bit and figure out which parts of the experience that people have with animals seem to be most beneficial in helping them move in more positive directions towards dealing with the signs and symptoms of PTSD. Now, I'm hoping at some point we get a chance to have a more detailed conversation about this. I'm looking forward to many opportunities to talk with people who are interested in helping those with PTSD about the kinds of things that are happening with medicine horse therapy and other animal-assisted interventions related to PTSD.